Hello and welcome to Chapter 24, Gastrointestinal System Disorders. Our learning objectives for today are describing how medications move through the gastrointestinal or GI tract to be absorbed for the body's use, discussing medications used for prophylaxis in mouth and tooth disorder and as therapeutics for mouth disease, explaining actions of medication used for stomach and gallbladder conditions, describing agents used for treatment of hepatitis B and C, describing actions of pancreatic enzymes, antiflatulence, antidiarrheals, carminatives, cathartics, and laxatives, describing how anti-inflammatory agents are used with large bowel conditions, discussing preparations used for anorectal disorders, explaining proper choice and use of medications for intestinal parasites, including the needed prophylaxis to prevent reoccurrence, discussing drugs used for appetite suppressants and their side effects, and providing patient education for compliance with medications used to treat diseases and conditions of the gastrointestinal system. Here we see a diagram, and this can be found in figure 24.1 of your book of the gastrointestinal system and how drugs act. So primary digestion is the process of converting food into chemicals that can be used by the body. The range of digestion begins when food is broken down by the saliva. It continues with the absorption of nutrients by cells and ends with the excretion of waste. The GI tract extends from the mouth, so all the way up here from the mouth to the anus, with all the accessory organs in between, the liver, the gallbladder, pancreas, and all of these assist with digestion. Here are some common disorder symptoms: loss of appetite and weight, abdominal pain, nausea and vomiting, changing in bowel habits, diarrhea, constipation, fecal blood, mucus, fever, heartburn, indigestion, difficulty swallowing, and diaphoresis. So what are the common side effects from these gastrointestinal medications? They can cause constipation and diarrhea, electrolyte imbalances, headaches, dizziness, vertigo, rash, abdominal pain and cramping, and others that you see listed here. Take a look more closely in your book at these two diagrams. I'm trying to see if I can find the page that they're on. They are labeled as easy working knowledge of drugs used for gastrointestinal conditions. So take a look more closely in your book at those two figures. What are some of the effects of the medications for GI disorders? So medications counteract the hyperacidity or flatulence, induce or prevent vomiting, or they're used to diagnose disorders of the GI tract. So how do these drugs act? They can increase or decrease function of the gastrointestinal tract by changing the muscle tone, increase or decrease emptying time as foods pass through the stomach, and change the rate of peristalsis, and replace enzyme deficiencies. It's important also to note that drugs for the GI disorders act either directly on muscular or glandular tissue or through the influence of the autonomic nervous system. Let's look now at some drugs used in the mouth. Many are oral preparations that relieve mouth lesions caused by local or systemic diseases. Good oral hygiene is essential to prevent oral lesions, and this is one of the things that we use in our patient education. It's important to note mouthwashes have a high alcohol content, some up to 27%, and should not be used by young children or persons taking any anti-abuse for alcoholism. Used also for gingivitis, tooth decay, and the halitosis lesions. We also have topical anesthetic agents. Take care to prevent injury to local tissues due to loss of sensation. So we use lidocaine or benzocaine, and these topically numb the area. There are also fluoride products, and these are used where water fluoridation is inadequate, so they take fluoride in order to get the adequate amount of fluoride needed. And fluoride prevents dental cavities or helps to prevent dental cavities. Oral antifungals are used for candidiasis or thrush, and some examples of this might be the Miselex or Nizoral. It's important that you avoid eating or drinking while the mouth or throat have been decreased in sensation resulting from topical anesthetic. So going back up here to our topical anesthetic agents, the patient should avoid eating or drinking while the mouth and throat have the decreased sensation. Saliva replacements. These increase viscosity for symptomatic relief of dry mouth and throat. These products are available as sprays or lozenges. So do you know why water would not be a good saliva replacement? It's because it lacks ions and lubricants. And in our saliva, we have those that help our mouth to stay moist. Artificial saliva products are cellulose derivatives with flavoring agents and antibacterials added to increase the viscosity. Let's talk about antivirals used for mouth conditions. These are used for palliative use only. They do not cure. They're used to treat herpes, varicella, or HIV lesions. And an example might be Valtrex. Here we see some images of peptic ulcers, and you can also look in your book and see more closely there, but I wanted to include that. There are 5 distinct categories of the anti-ulcer medications. They're antacids, mucosal protectants, antibiotics, anti-secretory agents, and antispasmodics. What are the goals of treatment of peptic ulcers? So the goals are to alleviate symptoms, promote healing, and prevent complications and reoccurrence. Let's look at some drugs used for gastric conditions. Let's talk about antacids. So antacids are alkaline compounds neutralize the hydrochloric acid in the stomach. They're used to treat ulcers or gastroesophageal reflux diseases, also known as GERD. Interfere with the absorption of many medications. That's why, again, we need to know what other medications and natural supplements that the patients are taking. And they are usually taken 2 hours after meal, and it's important to educate our patients on the time of administration. Antacids should be taken about 7 times per day typically, and taking chewable acids, it's recommended to take with a glass of water. When we're educating the patient, we need to let them know that alcohol consumption exacerbates ulcer symptoms, that dark tarry stools or coffee brown can be signs of gastrointestinal bleeding. Chewable antacids, like we just said, should be taken 7 times per day, followed with a glass of water. And antacids and H2 receptor blockers take at least 1 hour apart, with the antacid being taken first. Antacids don't take routinely with other medications unless you have checked with your doctor and made sure of how those medications react. So what food items tend to aggravate stomach and gallbladder conditions? Some of these might be cola, coffee, acidic juices, chocolate, and certain spices. So anti-ulcer medications, they are mucosal protectants which form a barrier to the ulcers. We want to educate the patient that the sucralfate should be taken on an empty stomach 1 hour before meals and not within 2 hours of any other medications. Should not be taken with aluminum and magnesium-based antacids. Antibiotics for the Helicobacter pylori might be amoxicillin or Biaxin. And the anti-secretory agents which stop excessive secretion might be Tagmint, Pepcid, Zantac, etc. There is a new class of medications that work by inhibiting chemicals that are essential to the production of hydrochloric acid, and these are called gastric pump inhibitors. These block the production of the hydrochloric acid. Something like Nexium would be an example. Prostaglandins, these protect the gastric mucosa, like Cytotec. Antispasmodic relieve gastrointestinal tract muscle spasms, like Levsin. And prokinetic agents stimulate the gastrointestinal motility by lowering the esophageal sphincter pressure and accelerating gastric emptying. So this is like the Reglan would be an example of that type of drug. Let's look at the drugs used to treat hepatitis B and hepatitis C. There is a current immunization available for hepatitis B, and this is a 3-step series. The treatment for hepatitis C, it's treated with antiviral medications, Pegasus or peginterferon. Chronic hepatitis B is treated much like hepatitis C. These medications are more effective when used with nucleoside analogs. An example might be the Epivir HBV or the Hepcira. Now we're looking at drugs used as pancreatic enzyme replacements. The pancreas produces 4 main digestive enzymes: lipase, amylase, chymotrypsin, and trypsin. Fat digestion is compromised if enzyme production is insufficient. In enzyme replacements, they are available in 2 preparations. So we have the pancreatin from hog or beef pancreas and the pancrelipase from hog pancreas. Both are capsules that can be taken with antacids and must be taken with food. Why do you think it's necessary to take these enzymes with every food intake? This is because digestion is compromised, and not taking enzymes with every meal exacerbates symptoms and delays healing. Now we're looking at drugs used with gallbladder disease. So gallbladder stores bile. This is the function. And the colitis